Hi, everyone. Michael Herrick with HIPAA for Humans, realistic cybersecurity advice for healthcare. Today, I want to talk about health technology startups. We're all familiar with that phrase, the cobbler's children have no shoes. And it's true in business. It's true in all sorts of business. Marketing companies have terrible websites. Construction companies work out of dingy, rundown offices. And technology companies build fantastic, exciting, cutting edge technology and ignore their own internal technology. They ignore their own inside office IT. I see this a lot. I recently finished a risk assessment for a health technology company just this week. They're doing some really cool stuff, some really cutting edge stuff with medical devices, with back end databases to store all of the PHI needed a risk assessment. Awesome stuff, in-house developers, in-house experts doing amazing technology, but they're not focusing those tech talents on their own internal IT systems. They don't have centralized device management. They've applied encryption on their workstations one at a time. They've never enrolled them in Active Directory or some kind of device management so that they can supervise and enforce those security controls. These are really common security controls. These are like the first thing that gets done at a hospital or at a doctor's office, but technology companies tend to put this off. This company, they had something like 70 employees with uncontrolled workstations. A doctor's office would fall to pieces. They would collapse with ransomware threats before they could reach 70 employees. Usually we see doctors' offices really need to get that centralized workstation management going by the time they hit around 15 or 20 employees. So it's crazy that a tech company grows to 70 employees without having those basic office IT operations in place. It's because they're tech savvy, and they know how to handle this stuff, and so they can grow a little bit bigger and get a little bit more complex, and they can manage that complexity. But it's not sustainable. You've got to get that stuff under control, and the sooner the better. First of all, it's going to make your life a lot easier to have workstation management so that you know that you're applying security controls as required by HIPAA. And you also have to think about what it would look like to an auditor. This is really basic baseline stuff for any healthcare organization. You'd never find a doctor's office with that many employees who didn't already have really solid workstation management with automatically enforced security controls. So for a tech company to go through a HIPAA audit and not have what a much smaller doctor's office would assume is naturally what they've got to have in place, it's going to look bad. So tech companies, don't ignore the unsexy tech. Don't ignore the boring stuff. Take care of that stuff. Take care of your own technology in addition to building the cool tech for your clients. This is Michael Herrick, HIPAA for Humans. Please follow, and I'll see you next time.